Therapists of Reddit, have you ever hated a client? Why? Yes, unfortunately. I worked with several clients with narcissistic personality disorder. They weren't in treatment to better themselves, they were in treatment to find other vulnerable people to prey on. I worked at an outpatient day program. The positive of the situation was that it gave the other clients real experience with setting boundaries and not letting others take advantage of them. Psychology student here. Thing is, when a therapist cannot maintain a professional relationship with one of their clients, like hating a client or falling in love, they have the option to end the relationship. Keeping a relationship with a client professional is one of the most important aspects of ethics in psychology, and usually a therapist is forced to end things as soon as things start getting unprofessional. How often it happens depends on the area the therapist works in, but it's not excessively common. However, no professional considers it a failure. Most professionals have a network of therapists or work in a practice, so they refer the patient to someone else. Sometimes it's due to a conflict of interest, like the therapist having a non-professional connection to the patient. Sometimes it's a logistical issue, like the therapist needs to reduce their hours or focus on a particular set of patients. Sometimes it's because something came up in therapy, like the patient developing non-productive emotions regarding the therapist. It could be any number of things, and the therapist just refers the patient to someone else. I'm a male massage therapist and I've hated one client I saw only once. Classic a type business asshole. Last minute booking, comes into the office late, speaking way louder than he needed to be to show off how businessy he was, then promptly left the office and talked louder in the halls, making me wait for him more. Bring him to my room, and he starts demanding extra time, gets on the table and starts demanding that we renegotiate the price of the session. Hard no on that regard. Then starts bragging about how he owns 3 apartment buildings and manages another 10 or so. Good for him, he's young and doing well, I'm not against that. What finally set me off was when he called his friend in session, again, and started bragging how one applicant was a single father of 3, who had the mother die a month before, but we don't want those kind of people renting from us. A widower is those kind of people to a cheap hollow braggart. The only time I've had any inkling to use too much pressure on purpose. But I used it as a good test of my ethics and did anything that compromised myself, but also told him we wouldn't be a match and I hope he finds a good therapist. I've worked on people I know have done worse things, but his haughty attitude and the fact he could but chose not to help people made him the enemy in my eyes. The attitude around him was against everything I am. Not the worst story for sure, but it fits. Therapist and former owner of a company with 200 therapists. It happens all the time. There is a professional responsibility to ensure that a client is getting what they need. Obviously, switching therapists is a bit of a hassle, and therapists should try to figure out what they are bringing into the therapy room that is making them have such strong feelings, but they need to connect clients to people that can help them the most. Therapist. Have a client who has very similar interests as my own. I have zero romantic feelings towards the client. Client asked me what the policy is on being friends. I explained to them friends is fine once treatment is over, but not okay prior? If I were in a city, I would have just straight up said no, but it's a town of less than 1,000 people and dual relationships are unavoidable. Once treatment is complete, I'd probably will become friends with the individual, as my interests are pretty niche, and it is neat to find someone with the same interests. As an added note, however, I know for certain it would never turn romantic. Client is younger than me, I have mommy issues of my own and pretty much solely attracted to women older than me. Hate? No. Frustrated? Absolutely. I find the toughest clients are those that want to be there, but for some reason, want you to do all the work, essentially making you have to pull things out of them. This is to be expected at first, no big deal, it's totally normal not to feel comfortable talking about things in the beginning. But eventually, it's exhausting. Think about things before your sessions, know what you want to talk about to a certain degree, take notes if that would help. Even if what you want to talk about is books and movies, that's totally fine. If that's what you want to focus on that day, we can do that. But please, don't make us or expect us to do all the work, we only have so many questions to ask. I'll take a BPD or NPD client, over a client who never has anything to talk about, any day of the week, hands down. I'm not a therapist, I'm a dementia care worker. I've never hated any of them, a very awful illness is literally ripping apart their brain and who they are, it's terrible and scary for them. If I get physically attacked, bodily fluids thrown at me, etc., it's because I've done something wrong. But that have been maybe 4, Out of over 300, in 15 years, who I've thought, you are not a nice person. Oddly, that's what the family will then come out and tell us. You know, they were always mean, they never loved me as a child, used to hurt me, etc. It's strange, but despite the disease, you can just tell. I had a couple getting divorced and we spent 8 months working through mediating the division of their property. Every 3 weeks, like clockwork, one or the other would tantrum and blow up the mediation. After 8 months, we finally had a contract, but they both wanted to go home for Christmas, before finalizing the mediation. Of course, when they got back, they were lunatics fighting over bed sheets and coffee mugs. I fired them and told them to pay a lawyer $500 per hour to tantrum. Yes, I hated them both by the end. I work a behavioral therapist for kiddos with autism. I've never hated a client, but I have despised the parents of some of the kiddos I've worked with. Many used the services my company provided as babysitting services, rather than behavioral interventions. They would hardly participate, some were outright neglectful, and others were just mean. I felt bad for many of my kiddos because, you can tell they are working hard and doing their best, but their environments make them hard to succeed and even live with. I always say I prefer kiddos over adults any day. I wouldn't say hate, but there are definitely some, where you just roll your eyes and sigh. We can give you all the tools to be successful, but it just depends on how you use those tools. Same thing with addiction. We can send you to rehab 100 times, you know everything you need to do. The only way things will change, if you want to change. An analogy I tend to use is like having you fix a door. If you have a sledgehammer, you are going to break the door. If I give you a screwdriver and teach you how to use it, you will fix the door. Hate usually requires having had a strong and/or important connection with them, strong emotion leading to a strong emotion. I disliked them. It was basically verbal abuse working with her. She would send me pages and pages of emails and multiple gigantic text messages a day. Sometimes she would come to session very sweet, and other times would be screaming at me and accusing me of things I didn't do. I couldn't refuse to work with her and had terrible support from my workplace because it was a nonprofit. My supervisor would mostly respond to my concerns with "Aw, she's having a tough time." I constantly set boundaries, but she would disrespect them. I was still able to be helpful to her and she felt a connection to me, but I was anxious every day expecting her interactions and hated my job. I ended up leaving that job for that reason and many others to start my private practice. It's been going great. Without restating too much of what others have said, no, I've never hated a client. Have there been some that were frustrating and got under my skin at times? Sure. But they were growing experiences that forced me to be introspective and improve. I was trained that if a client is evoking a negative reaction in me, that's my responsibility as a clinician to address, figure out why, and either fix it in supervision/my own therapy, or if it's an issue causing too countertransference, refer to a different clinician. Yes, I worked as a therapist, and I specialized in teenagers, but also worked with some adults. One lady I only saw once, she came in and told me about how she suffers from self-diagnosed depression, PTSD, and severe anxiety. I told her she needed that professionally diagnosed and she claimed that she didn't and that I should be able to. I decided to go ahead and diagnose her myself, but I wouldn't tell her because I'm not qualified to. She claimed her PTSD came from 2 weeks ago when her son called her a bad mom for taking his phone away. That's just usual 10-year-old behavior. She went on about how she gets sad occasionally, and I seriously cannot stress how much she didn't have any mental disorders. She wanted me to diagnose her, so she could use it as an excuse to act out. After about 10 minutes of her rambling about how her middle-class life is unbearable because her husband cannot take her on a date every other night. Look, everyone had their problems, but I wasn't liking the way she was treating a mental illness as an excuse. I redirected her to a friend in the same building, who does diagnose mental illnesses, and she left and saw him. I talked to him later and she had quite literally nothing wrong with her and apparently, she demanded to be diagnosed. I worked as a tech in a detox unit. 98% were great people, just with problems, but 2% were mostly out to burn the world down around them. One guy I knew was not fixable and talked about how he is doing this to beat a charge. He would make staff day a living hell, just to see if we would sign his paper, and let him leave early. He had a team of girls who was head over heels in love with him. When he left, the girls all signed AMA out with him, some married. 3 months later, all the girls were forced into being prostitutes by him, and all but one overdosed. He went to jail for simple drug charges and was not charged for the deaths of the girls, due to not enough evidence. The last girl came back to me and told the whole story about all the things he did to them before she died from AIDS. The dude is a pure narcissist/sociopath and only seen the girls as ways to make money. My dad is a therapist, who serves as a court-appointed option, here in our city, specifically with issues involving child services. He's spoken to the parents and children involved in pretty much every kind of trauma and often at the hands of the parents or under their care. He's often shared with me, generally, never anything that would be a breach of privacy, sometimes, when he's spoken with some truly vile humans, but the thing I've noticed is that he always sees the human being, who also is the product of some pain and trauma. He's always told me you can hate someone's actions and their choices, but to hate them isn't right or helpful to you or them. Hate is a strong word. I have had clients I have disliked working with. Mostly because they were adversarial, or they weren't ready to change. This oftentimes looked like perpetual self-pity or giving every reason why they aren't at fault. It usually ends with me telling them that I don't think I am the right person for them and that I will try and find them someone different to work with. I can't say I've hated a client. As a professional, I'm going to treat all of my clients with the same non-judgmental, unconditional positive regard. That being said, I am a human, and there are definitely certain personalities or diagnoses that I find more challenging to work with than others. No. I have absolutely hated behaviors and symptoms, but never the person. The more hateable a person presents as, the more I am motivated to work with them, because it is usually a product of complex/developmental trauma and attachment wounds. I'm an attachment-focused EMDR therapist, so the entirety of my work focuses on conceptualizing the impact of attachment style and trauma on cognitive, emotional, and behavioral experiences. This lens makes it really hard to hate anyone. No. Any client I've been frustrated by at first, I've come to understand eventually, and their behaviors make sense in the context of their history, and I help them work through both the behavior and the history. The clients I might have the potential to experience that level of countertransference against, is more often than not going to get screened out before they make it to me or get discharged from my setting very quickly, adult male clients that make sexually explicit comments to adolescent female clients. I use the word countertransference here and not hatred, because if I have a strong negative reaction to a client, that means there is something in me that I need to look at. If someone is a pain in the ass, it can be therapeutically useful to name that in a more diplomatic way and explore how that shows up in their other relationships and where it comes from. If someone is cruel to others or has significant challenges with interacting with others, they aren't a good fit for my milieu treatment setting anyway. That just means they would be better served by someone else. I once had a horny teenager come to me for therapy about his anger issues, but he would always have a boner, and would always talk about something related to sexual desires. I really hated that kid because I wanted to help him cope with his anger, but he didn't do anything in therapy and then his parents would tell it me, because they would not see any improvement. This is just sad. Sports therapist in training here. I don't really have any clients I hate, more like it's mildly annoying that some of them don't understand my explanation even though I kept my explanation simple, gave them a kinesthetic, auditory and visual representation, all in the textbook. But I still manage it out. My mother is a therapist, and yes, she definitely hates some of her clients. A lot of them are genuinely terrible and unpleasant people to be around. However, it's her job to give them an out and she gets paid to talk to them. Hate, as in I would be happy to hear that she died in a car fire, screaming as her flesh melted? No, but I did have one client that I very strongly disliked. Nobody at the clinic couldn't stand her. She had both borderline and narcissistic personality disorder. She had a terrible temper, and just simply treated everybody in her life like absolute shit. She was an enhanced Karen, I've never met anyone who had such vile, seething hatred for literally everyone she had met. All it took is for a person to displease her once, and she wanted them torn limb from limb and their houses burned with their families inside. She would call me almost every day even if I wasn't at work, then bomb me with text messages that got progressively angrier and more abusive because I refused to answer my work number for anyone when I wasn't on duty. She would accuse me of neglect and malpractice and would threaten to report me. She, of course, complained to my supervisor who, to this day, is one of the best supervisors I've ever had. My supervisor politely and in clinical terms told her that contacting me outside clinical hours was a boundary violation, that she had other options for mental health crises, when her primary clinician was unavailable, of which she had been made clearly aware, and that if she didn't like those options, she could go fuck herself. She also would demand to change her appointment times every single week, usually only about an hour before they were to begin. If I was unavailable at the new time, she would bomb my phone, and then when I didn't answer, she'd call the front desk and demand that they reschedule whoever I was seeing at the time that she wanted to switch her appointment to, often threatening to report us for neglect if we refused. She had sought services and dragged her unwilling boyfriend along for couples counseling. Really, what she wanted was for me to yell at him and tell him to do everything she demanded of him. Now, he was no saint either, but he was a bit more normal than her, and his anger was mostly directed at her and her equally horrible mother rather than everybody. They would both just argue and fight the entire time. Neither would compromise on one single thing in their lives. She had wanted completely control of his life, when he woke up, when and what he did around the house, what he did for a job, what he did for fun, and she wanted him to have sex with her on demand. He decided to just not do anything. He would stay up half the night playing video games. He did help out a lot around their house, but he woke up on his own time, did chores on his own time, applied for jobs that he wanted to do, and refused to have sex with her because of how disrespectfully she treated him. His behavior was partially laziness and stubbornness on his part, but a huge part of it was out of spite and just being fed up with her. It was a train wreck, and neither wanted to leave, her out of fear of abandonment, and him because he simply didn't give a fuck about anything anymore. In our final session, she chewed me out for being ineffective and unqualified, and suggested that our clinic was violating state guidelines by allowing me, an MSW intern, to be their clinician, instead of assigning them an LCSW or LPC. I explained that by working directly under an LCSW, we were completely within state and national guidelines. My credentials were made perfectly clear at the beginning of our work together, and they had the option to look elsewhere months ago, if they hadn't wanted to work with an intern. All in all, I couldn't give less of a shit that she was dissatisfied with my work. I was just glad to be rid of her. I had the opposite problem. I was very badly abused as a child, in pretty much every way you can name. I suffered terrible nightmares and flashbacks, anxieties, especially over my mother, who I am now not in contact with, and while I am worlds better than where I was years ago, I know for a fact that to get to where I need and want to be and deserve to be in life, I can't accomplish it on my own and I need help and therapy. I want to be there. I want to do the work. I owe it to myself, and my wife to be the best person and best partner I can be. My last therapist and I ended up dropping after about 3 years, because all I ever got from her was one-word answers and asking if my billing for that month was paid up. I never got guidance, never got advice, never got actual help. She listened and told me how she could feel how hurt I was over what had happened, and that was literally it. If I just needed someone to listen and empathize, I could talk to my dog and not have to pay him $200 an hour. I'm looking for a new therapist now, but I really want to try EMDR therapy, and the only 3 therapists I can find in my area that do EMDR and seem to have experience with the other issues I need them to help me with, all aren't taking new clients. I'm 8th on their waiting list. It's just so frustrating.